And then go ahead, Sahaja, then Cindy.
Hey, Saha.
Hi there. Thank you. I've been listening to the past two people, and it just feels like, well, especially the last person, it sort of addresses what's happening, but I just wanted to ask about it anyway.
Honestly, it's most of us. Like,
well, I didn't know about, what did you say, the marjoram and what was the other one? Peppermint.
or like the pain relief, neuropathic, anything with a
Yeah,
mint in it is always good for nerve pain.
Right. Okay. Well, my question's more about my bronchial. I have, and this is what you were just talking about, but I just want to say it out loud and see if it's what you were just telling her corresponds. So I feel like I'm just having, it's right like around where my collarbones, my throat is, irritation there. Like, so it's my really upper lung area.
Okay.
And it just feels like, I want to just cough, and it's just irritated. And the only thing I can compare it to is like, and when I've had viral infections, it's like the very end of that viral infection where you can't quite get rid of that little last lingering piece. And I've had it about a week. I don't know if it's allergies. I don't know, if it's sleeping in a room with a dehumidifier because it's so damp here, and maybe it's dehumidifying too much. I just was wondering what would be something that would be the most effective for that.
Just describe the cough a little bit better.
It's just like,
does it feel like a little spasm that's just like in the throat, or?
Yeah, exactly. It's an irritation, and it's like, and it's nothing comes up, it's dry, it's just irritated. And that's about the best I can describe it.
So what I would call that is a spasmodic cough. It's actually sometimes they're not it's actually not like respiratory. It can actually be soft tissue, and you get like this cough because like some of the muscles around there go into a spasm and it produces a cough, but it's not really your respiratory system having that reaction. So
I mean, it just feels irritated. Like when I breathe, it feels irritated. I don't know if that's a spasm can do that.
yeah, it can. Like there's like a little thing, like a little tickle or a little irritation in the throat.
Yeah, exactly.
So I'm going to have you try like a couple of different things. You're really just going to inhale into that, into your nose and then into that area that you just described. I don't know that you need to follow a big pattern, but two choices would be to use thyme. Any form of thyme that you have, just any form if you have it. And then
Yeah, I do.
sometimes with that too, I have people use thyme, but take like 2, 3, even 4 drops of cypress internally. Like do that like once or twice a day, and then inhale the thyme often. You could also play with eucalyptus, but I think that thyme will probably get it. The other thing that you could add, that if you really wanted to try to do it, and I like having this stuff around the house no matter what, but there's those herbal capsules that you get from, you can get them from Amazon or whatever, but lobelia, like just a capsule once to 2 times a day, and it is also good for a spasmodic cough. And so I think the combination, I will say, like, the coughs that came from COVID were not like normal. Like they didn't fit in. Like it's almost like they were their own thing. And I suspect that, this is why I keep going a little bit deeper and deeper on the diaphragm, is I think that virus really disrupted the nervous system quite a bit. hit the cardiovascular system somewhat, but it really threw the diaphragm and some of the muscles in the throat into a kind of spasm that, you know, you only see with really super crazy, like bronchitis, pneumonia, things like that. And even some of the chest muscles on a lot of people, people were thinking that they had like cardiovascular issues. They'd go to the doctor and the doctor is like, nope, clean bill of health. But there's like they call it like pseudo heart pain or something. And it's just basically, it's chest pain, but it's the soft tissue. So like this whole area up here for, you know, most of us got pretty compromised over the last few years. And even though the condition went away, when something else comes up again, we're kind of back to that spot again. Not so much the viral activity or the bacterial activity, but the activity of the soft tissue and the fascia and all that. And so I think all of this is kind of a good remedy for this. Like do the thyme, do some cypress internally. If the thyme's not quite working, switch over to like some form of eucalyptus. You know, you don't even have to be super picky about that one. Probably not ironbark or citrodora, something that smells like eucalyptus, not the lemony forms, but the, you know, radiata or globulus or polybroct or smithy or, you know, something like that. And if you don't have that, you know, hyssop, you know, something. And yeah, worked that pretty hard. And then even a couple capsule, you know, one capsule at a time of lobelia, if that's still needing a little help.
Okay.
Yeah.
Well, does lobelia like really knock you out? I sort of have this memory of
It doesn't. Like,
Okay.
I mean, I've never had that. You know, you don't really take very big dosages of that. And so it does relax the body. And, you know, maybe if you're exhausted, it would knock you out a little bit, but it's not really so much a relaxant. It's more of an antispasmodic. And it's really good for relaxing fascia. Like it's really good for it. It relaxes the diaphragm. It just relaxes everything.
Okay.
Yeah, but not like in a sedating way. It's just like body tension diminishes. You know, in the old days, it's what they used to treat for lockjaw, like when somebody would get bit by a dog or whatever and get rabies and they'd get lockjaw. Like the way to treat it was to use a bunch of lobelia and it would unwind the jaws.
Okay. That makes sense. I'm just having memories of lobelia and learning about it many years ago, and I couldn't quite remember about what it was, but yeah.
It got a little bit of a bad rap way back like 60, 70 years ago, because like one of the things that people used to use it for was as a emetic, which means they would give you a really big dosage of it to make you throw up. And it, like in a big dose, it does relax the body to where you have to give them like some cayenne pepper to jumpstart the body again, but they are trying to make you throw up. And I was like, if you try to make people throw up, there's better things to use than lobelia. That was the old thing to do, you know, and people don't do therapy like that anymore. That's the therapy of 100 years ago. I mean, every once in a while, there's a reason to make somebody throw up, but it's usually, you know, they've either ingested something that they need to get out real quickly, or that massive amounts of mucus that, like when you have like a sinus infection, drops down the throat and goes into the stomach. Like sometimes you do it so that the bacteria doesn't spread through the body, but it's not a very popular treatment. You know, I used to do it like 20 years ago or something, and it's effective. But, not very many people like throwing up. Who likes throwing up? Buddy.
Okay.
So
Well, I'll try this and
so that's also why to keep the dosage small, because if you keep going bigger, it eventually will make you vomit, but you would have to do big dosage.
Okay. I won't go for that. Okay, thank you so much.
You're so welcome. And keep us posted on that. If you need more, we can do more.